to reduce pain without having to go the pain medication route or to minimize
the pain medication.
Oh, they're on enough medication usually, right? They don't want to take anything else.
And that's why an anti-inflammatory diet also helps to decrease pain as well.
Good. Yes. That's wonderful. The diet stuff is really helpful, and you use all those big words so well. I'm glad I didn't have to trip over them. Well, thanks for joining us, and thanks for sharing
my pleasure.
That information.
Anytime.
I really appreciate it. It's always nice to see you. So this
Same
is
here, Amber.
Dr. Konisberg, and again, it's integratedmedicineinc.com in Burlington and Toronto, which is wonderful. And hopefully we'll see you again.
It'll be my pleasure.
Too. So we'll take a quick break. I'm hoping that Kathleen's Skyped in. And is she here right now? Great. We'll just take like a 10-second break and so that Esther can leave. And
thank you for joining us.
We'll be right back with Kathleen.
Do you suffer from back pain, sciatica, or other debilitating conditions such as neck, shoulder, or foot pain? Find the relief you're looking for at Let It Heal.
As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief for my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal or drop by their clinic in Burlington.
Fibromyalgia is a debilitating condition that affects almost 1 million Canadians today. If you have fibromyalgia, Let It Heal has a treatment that can help you. As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief for my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal or drop by their clinic in Burlington.
Okay, we're back. Just a quick break there, and we've got Kathleen Skyping in, I think from Seattle. You're not in Egypt right now, are you, Kathleen?
No, I'm not.
Okay.
I'll be returning to Egypt in December.
All right, so you get a little break from the heat, eh?
Yeah. Yeah, it's pretty cold and gray and drizzly in Seattle right now, so I'm looking forward to the sunshine.
Yeah, I bet you are. It's one extreme to the other. So thanks for joining us. You're just a wealth of information with regards to not just the CCSVI. I mean, I've watched so many of the videos that you've posted on YouTube that are available, whether people have MS or not. You share such wonderful thoughts. But I'd like to find out a little bit about your story, and when were you diagnosed with MS?
I was officially diagnosed in December of 2006. It was my Christmas present.
Oh.
And it took me about 2 years to get that diagnosis. I was a tenured faculty member at the time, and I took a leave of absence for a quarter, and I went to 44 healthcare provider appointments.
Wow. And that's in the States, too.
Yeah.
It's expensive.
My goal was to get a diagnosis before the quarter was over, and I did. The last 5 minutes, slid in under the bell.
Good for you. Persistence pays off.
Whew.
Not that it's a great diagnosis.
No.
But sometimes just having an answer. So, so when did you hear about the CCSVI treatment?
You know, I've tried to pinpoint that. It started as this little buzz, but you know, as an MS patient, everybody has told me some cure. Oh, bee venom. Oh, B12. Oh, you got to do this. And so I just kind of swatted at it like it was a gnat. But the buzz got louder, and I think it was January.
Okay.
January or February. I know that I knew for sure in March. I attended a grand rounds at a local hospital, which a very prominent neurologist was presenting on MS, and I had just learned about CCSVI, and one of my doctor friends invited me to attend with them. So that was my first official encounter with CCSVI.
And you didn't know at that point how much it was going to change your life. I think probably we owe it to the audience to explain a little bit about what CCSVI is. Just because, I mean, everyone's always focusing on the spinal cord and the brain with
MS. Yeah.
And actually, I brought a picture. What Dr. Zamboni discovered was just like sometimes arteries collapse in the heart, and they have to put a little balloon in there to open them up, or a stent. Same thing happens in the neck.
Yes.
So what they were finding, just to sort of paraphrase and simplify it, was that the blood wasn't draining adequately. And you can correct me if I'm wrong here, Kathleen, too. It's just that the blood's not draining adequately from the brain, so there's an iron buildup, I guess.
Right.
And once they go in and they perform this quick procedure, they're finding amazing results from what I gather. Is that right, Kathleen?
Well, I certainly had amazing results, and nice job on the explanation. That's my jugular veins and my azygos vein, which is a vein in your chest. They were blocked. My brain was not draining properly. And it's like if you imagine a pail with, a hose going in and a hose going out. If it's not going out, it's not going to go in very well. So
yeah, that's right. Exactly. There's no room for fresh stuff.
Exactly. Yeah.
And you end up with what we call a swamp brain, and it's not a pleasant way of existence.
I can't imagine it is. No. I mean, along with all the other symptoms that you've got this
like fog.
Yeah.
Mm-hmm. Yeah. And my livelihood, excuse me, sorry, depended on my ability to think. And I was no longer able to think. In fact, reading really wasn't an option for me because the concentration that it required to get through a sentence, I would read the first part, and by the time I got to the second part of the sentence, I could not remember enough of the first part to make sense of the second part.
Oh, wow. That's there's probably people sitting there watching, or people that are going to watch this episode that are sitting there nodding, going, yeah, that's me, because it's a pretty common symptom. So when did you get liberated? When did you have this procedure done?
May 27th, 2010. It's my new birthday. And I had improvements on the table.
Oh, wow. Lucky you.
I'm one of the very fortunate ones. Not all of us have the immediate and dramatic improvements that I had. But I was restored to health.
That's wonderful. I want to talk about, I mean, you mentioned the brain fog. What other symptoms did you notice that improved dramatically for it to change your, obviously this has changed your life. Like you said, it's your new birthday. Mm-hmm. And you're out there shouting it from the rooftops, which is wonderful. But what other things improved for you?
My vision sharpened. We call it going from digital to HD. It's like colors were more saturated. Everything just was sharper. It's like visual cues used to just sit on top of my brain, and now they seeped into the part that processed them. So vision, my balance. All I had to do was move my head slightly or move my eyes, and I would lose my balance. Yeah. My balance improved, my grip strength improved, my voice became stronger. I could hold more than 2 or 3 thoughts in my head at a time. I could access my memory. It's not that I didn't have a memory, it's just I couldn't access it. My neighbor once asked me, "Were you gone last weekend?" And I just had this blank spot, and I had to look to my husband, and he went, we went to Vancouver. And when he told me that, I go, oh yeah, and I could remember everything about the trip, but I could not remember that we had gone until I was reminded. My walking got better. I could move faster. I actually was taking a walk, and I started skipping down the street. And
I don't blame you.
Yeah, that's wonderful.
Oh, I wish we had a video of that.
Yeah.
I started crying. It just felt so joyful to have my body in motion again. My bladder function returned to normal. I had post-void residual. I could not empty my bladder completely. And I'm proud to say I can pee like a racehorse now. And
these are all things that we all take for granted.
Absolutely,
right?
yes.
I
we
mean,
don't even realize that this is something that happens.
Yeah, it's you're you again, right? You've
and
got
me
your
again.
life back.
I feel like me. The worst symptom was this one that I called tin head or stainless steel skull, which is interesting that I used a metallic reference. Learning now what we know about
yeah,
iron.
no kidding. That's so true, eh? You were onto something. Wow, well, I love the way that you speak, and I would love to encourage viewers to go and find your videos on YouTube. What would they look in what would they punch in if they were going to do a search for you? Just Kathleen Lynch, Lynch?
Well, my channel is KLynch56.
Okay.
KLYNCH 56. And the latest video I have up is me dancing. It looks like I'm an entrant to Dorkfest 2010. That doesn't matter because I wanted to get the attention of Ellen DeGeneres.
Oh, right, yeah, I saw that on your Facebook.
Because I think Dancing with Ellen would bring attention to CCSVI. And you asked me earlier when I first heard about it. I heard about it through some Canadian Facebookers, and I am so grateful to all the Canadians who put such a push behind this. I don't think I would have heard about it otherwise. And I think that if Ellen gives this attention, it can only bring positive attention to Canada. And it would be my way of paying it forward, because that's what we do. We have this little underground, and it's a Facebook underground. Facebook manifestos and YouTube communiques, and we help each other find the doctors. It's been an amazing, amazing journey, and I've met so many wonderful people. I owe so much to so many. And it's been a very cooperative effort. It's been amazing how people have been very generous with their...
Yeah, I see some of the donation requests. I know I've joined, like, GoFundMe is one of the things you can donate, even if it's just $20 or $5, whatever, right? You can help people, you can learn about their progress. It's quite a community. I see what you're talking about. And it's because of changes like yours. I mean,
absolutely, people are supportive of it.
You're showing people a glimmer of hope, and you're not just, yay, I've got my life back, I'm going to do what I want to do now. You're helping other people, and I think it's wonderful. I see how much effort you're putting into it, Kathleen, and I hope you realize what an impact you're having on the community.
Just bring it forward. It's like I was in a burning building. This part makes me emotional. You'll have to forgive me. I was in a burning building and I got out, but I can still hear the people in the building calling for me to help them. And the more of us that get out of the building, the more of us there are to go in and get the rest out. There are millions of people around the world who suffer from this. And my suffering was alleviated so easily, so dramatically, and with a very low risk procedure. And it's so the risk involved with my procedure is nothing compared to some of the risks involved with the disease-modifying drugs that they use.
Well, yeah, and we'll probably get into a little bit of controversial stuff now that we've had our lead in. I know there's a lot of controversy out there. We've got our next Skyper going to be coming in, so I think at this point I'm going to have to say thanks so much for joining us. Probably, I did read your burning building excerpt that you had written, and it's beautiful.
Absolutely,
so yeah, thanks so much for sharing all of your experiences with us in so many different ways.
Absolutely.
Well, thank you so much for inviting me on to your show, and Dr. Tariq Sinan and his entire medical team send their greetings to all listeners.
All the way